Good morning. I also brought Elisa Zastopel with me this morning to help with the presentation. My name is Katrina Rothenberger. I'm the Public Health Division Director for Marion County Health and Human Services.
And good morning, everyone. My name is Elisa Zastopel. I'm the Deputy Incident Commander for Marion County's COVID response.
Mic on.
Yeah, the mic's on, or pull them as close as you could, please. We're a little weak.
I think I'm going to start, and I will start with just our statistics. What?
Closer
I'm sorry.
to the
We
mic.
can't, I don't know if the mic's,
Oh, is it not on? It's got a green light.
Okay, yeah, just pull it close to you. Thank you.
Is that better?
Yeah.
Much
Okay.
better. There you go.
Apologize, guys. So Elisa Zastopel, Marion County Health and Human Services. I'm just going to give an update about our statistics for the COVID response right now. As of 9/16/2020 at 8 o'clock this morning, we had 4,291 cases. This number includes confirmed and presumptive cases. 4,096 people have tested positive, and 44,019 have tested negative. The weekly percent positivity rate for the prior week through 9/6 was 11.1%, and that's an increase from last week. Our case counts continue to trend down, with the majority coming from our northeastern part of the county. We will continue to, on our team, complete our contact tracing and case investigations. We'll continue to provide testing resources and PPE to where they are needed, including outbreaks, our vulnerable populations, and fire personnel is included now. Once the air quality improves, we plan to resume all of our testing events. And our next big plan is to start working on administering vaccine and figuring out how we're going to do that. I'm now going to hand it over to Katrina, who is going to talk more about the response with COVID and fire.
Yeah, so I just wanted to touch a little bit on the role of public health in two major catastrophic events happening simultaneously. One of the major responsibilities of the local public health authority is to ensure for the safety and health of our first responders. And what that looks like is, as we have a bunch of firefighters coming into Oregon, we don't want them to get COVID and spread that and create an outbreak. So we've been working with our liaison to ensure that we have a smooth process for testing, isolation, and quarantine of these folks and catching that early. So we actually have had to utilize this process already. It happened pretty seamlessly, and Yamhill County has been gracious enough to help us out with isolation and quarantine of our presumptive COVID cases or COVID positive. So we're really thankful for their partnership at this time. The other major role is staffing the Emergency Support Function 8, which is health and medical. And that includes monitoring hospital status, long-term care facilities, foster homes, group homes, supporting PPE distribution, as Elisa mentioned, to these vulnerable populations, and also providing an environmental health inspection of the congregate shelter at the fairgrounds. So we've had our health inspectors out there twice so far, once just a few days ago, and then again last night to look at all of the living quarters, food distribution, any restaurants that have been on site. Yesterday, I believe Dutch Brothers was there handing out coffee, which was great. So it's been quite a stretch on the public health system, as it has been on the entire county. And we have a lot of staff and their family and friends who've been displaced by the fires, who continue to show up to work every day and help on this response and the COVID response too. So I just wanted to acknowledge their contributions and say thank you. And we're going to continue to monitor COVID and do our best to control the pandemic, as life looks a lot different for a lot of us these days. So thank you.
Thank you, Katrina. Are there any questions for Katrina?
yeah, Mr. Chair, thank you. Katrina, and yesterday, and I know we had our weekly call with our underserved people of color meeting, and one of the things, they had several of these outdoor testing set up, and I think you said that we were going to start those as soon as air quality started up, and that's one of the challenges that we have, because in those communities, Woodburn, Jervis, Central Salem were having the biggest outbreaks, and that's where we were doing those tests. So what's the air quality level before we can safely resume those tests? Do we know? And what the prediction is?
I think we should begin to look for alternative ways to administer those tests, try to find an indoor space. The Oregon State Public Health Lab has been closed for the past 3 days because of the indoor air quality was so poor. So testing statewide has been challenged because of that. I think the air quality right now is extremely hazardous. And we should probably look for ways that we can support administering testing in a safe manner while the air quality is like this, because we do know that COVID symptoms and symptoms of smoke can look similar, which is also could contribute to further spread of disease. But the symptoms are cough, difficulty breathing, runny nose, headache, and fatigue are both symptoms of COVID and wildfire smoke. The symptoms not related to wildfire smoke are the fever, chills, muscle and body aches, vomiting, diarrhea, and loss of taste and smell. So I think that we need to prioritize our communities that have been impacted by both smoke and COVID.
Is there any discussion of when we have these tests set up for these people coming in to actually to do flu vaccines at the same time? Have we talked about that? Is there capacity to do that?
Yes, we've been talking with our agencies that we have contracts with, and we've issued them contract amendments to support administration of flu vaccine as well. So as soon as we get that in and contract signed, we'll be happy to do both.
Great. Thank you. Thank you, Mr. Chair.
Yeah. Commissioner?
No, I just, one little comment to Katrina. I just note that there's things that I don't even think of, and I'm glad you're thinking of it.
Yeah.
Every day there's some new twist and needs to be covered. Thank you.
Thank you.
Thank you,
Thank you.
Katrina. Thank you, Lisa.